A Reveal investigation has uncovered an increase in unexpected deaths at licensed Georgia facilities that care for the mentally disabled. This is happening as the state is fighting to withdraw from federal oversight of its mental health care services after years of insufficient care. And now families of the deceased say our findings reveal Georgia isn't ready.
Matthew was wonderful, sweet, very compassionate.
At an early age, Matthew Bowler never shied away from attention or showing affection.
He would always give me big old hugs.
His mother, Dorothy Berry, says he excelled in sports.
Matthew played football, basketball, and baseball. And he was a champ at each sport.
But when Matthew turned 19, something changed. Something wasn't quite right. What happened?
He started changing. He started getting quiet, staying more to himself.
In 2016, an argument with his sister led to a fight, breaking car windows. A judge ordered a mental evaluation, and a doctor diagnosed Matthew with schizophrenia. A short time later, the 22-year-old Stone Mountain man was sent here, Georgia Regional Hospital, a state-run facility which treats mental illness. Berry was nervous about the idea.
But I wanted my son to get better. I wanted to find out what was wrong with him. I wanted to know what was going on with him.
Turns out she had good reason to worry. 6 months later, staff found Matthew unresponsive in his bed, dead. A 2017 state investigation shed little light into what happened.
They tell me that Matthew was woke at 6 to take medication. Autopsy said, and the state said that when they touched Matthew, he was cold to the touch. Now, if your body cold to the touch, I'm sure you had to be dead for a while.
The investigation cites conflicting reports of Matthew's time at Georgia Regional. Some staff said he was taking his medication, even smiling months before his death. But the report also indicates Matthew was so miserable, he begged to go back to jail and tried to hang himself. The medical examiner's office ruled Matthew's death not entirely clear, unexpected. Are you okay with potentially never knowing what happened to your son?
No, I'm not okay with that. I want to know what happened to my son. I think I deserve to know what happened to my child.
A Reveal investigation uncovered similar deaths ruled unexpected have increased nearly every year at Georgia facilities licensed to care for the mentally ill. Since 2014, more than 500, according to state records.
I did not know about those numbers. Those numbers are astonishing when you look at them on any level.
Eric Jacobson is the executive director of the Georgia Council on Developmental Disabilities, an advocacy organization.
It begs the question about what's the state going to do, what are providers doing, why is this happening, and what can be done to rectify the situation.
The state's poor treatment of its mentally disabled stretches more than a decade, from dozens found dying at state hospitals in 2007 to a U.S. Justice Department lawsuit that led to federal supervision of Georgia's mental health care services today. According to a 2018 report submitted to a judge by an independent reviewer, Georgia continues to take too long investigating deaths, saying, until fixed, the system cannot be described as effective.
We don't think that we need federal oversight anymore.
Judy Fitzgerald is the commissioner of the Georgia Department of Behavioral Health and Developmental Disabilities. She says the state has overhauled its mental health services since the lawsuit and wants federal supervision to end. Why should the public trust you that you can move forward protecting these vulnerable populations when that independent reviewer says you haven't quite done it yet?
What she has said is we're not doing it fast enough. When we do a review, and I will stand by our department's work, we have very, very thorough and comprehensive policies and protocols about what happens when a vulnerable individual experiences an incident anywhere throughout our system. We just believe we don't need federal oversight to continue that work.
Do you agree with that?
No, I think that the DOJ needs to remain here.
And these are just little pictures I had of him.
A family searching for answers, haunted by memories of a son begging for help.
When I would call him, I could hear him kind of crying in the background, telling me to get him out of there.
Did the state have anything to say about Matthew's unexpected death?
Because of privacy laws, the state says it cannot discuss his treatment or any additional findings. According to the investigative report, at one point a hospital administrator substantiated staff neglected Matthew, but they won't provide any details of that neglect.
Andy, do we have any idea when we'll find out whether federal oversight of Georgia's mental health care system will end or continue?
No, the state has made it clear that they want federal oversight to end. The Justice Department is not commenting.